Hi and welcome to another episode of Health Plus. Our topic of discussion today will be occupational health hazards. One of the main concerns for the employers nowadays are protecting the health and safety of the workers. Health of the workers in relation to his or her work and related work environment is a factor that determines the productivity of the work as well. It is the duty of the organization to protect the workers' health against hazards while at work. Today we have with us Dr. Abraham Verghese, and our topic of discussion today will be occupational health hazards. Welcome to our show, Doctor.
Hi.
Can you tell us what exactly is occupational health hazards?
Occupational health is health of an individual in relation to the work and the working environment. When you talk about occupational health, it's basically prevention and maintenance of the physical and mental well-being of an individual in relation to the work and the working environment. That's what we call it as occupational health. Now, due to the rapid industrialization and the fast growth of various activities, the individual, any individual, for example, any occupation, these people are exposed to a lot of hazards in the work environment. So that we classify as different hazards categorized as physical hazards, chemical hazards, biological hazards, then occupational cancers, occupational accidents. These are all the different hazards in total about the hazards.
In the years gone by, we've been told or we've been known that these hazards only happened in industries.
Then,
what has happened now?
When you take the industrial hazards, the worst hazard, the worst tragedy we have ever come across is the Bhopal tragedy. It happened in 1984, December 2nd. Now, only after the Bhopal tragedy, we Indians, we thought of these issues in detail. Probably countries outside, they had occupational health centers, they were thinking of occupational problems. But in India, after the Bhopal tragedy only, we brought up an awareness among the industries in total and in other occupations also. Because after the tragedy, the Factories Act has been amended in 1987, which very clearly says that every factory with more than 250 employees, especially if it is a major accident hazard unit, it should have a basic occupational health program. The basic occupational health program means the employees in a factory should undergo a health surveillance program. That is number one. Number two is workplace monitoring. That is monitoring the work environment. What are the hazards in that workplace, how we can take care of. That is the workplace monitoring. The third is personal protective equipment for all the employees depending on what type of job they are doing. So this concept of occupational health program has come after the Bhopal tragedy.
Is there a reason for that could be averted? If people were staying a bit away from the factory or the industry, would they be less affected? Or is that the gas leak just happened to wherever you are? How close, far are you from it?
No, definitely if we talk about the Bhopal tragedy, of course, the awareness level among the people outside was much less. Like as you mentioned, if you stay away, naturally the hazards will be less.
Okay.
But see what is happening. See, if you take the industrial scenario in Kerala, if you take most of the industries are located in the industrial belt, like the industrial area. But people start moving into that area, start coming when a township develops and people start residing in that roundabout areas. Naturally, when there is a gas leak or anything, naturally the people around will be affected more.
Okay.
But these hazards definitely can be arrested if we focus on the prevention.
Okay.
That is what in the occupational medicine also we focus on.
So, doctor, can you share with us some of the studies that were done recently?
International Labour Organization (ILO) has done a study on occupation-related accidents, fatalities, illnesses, and all those things about 5 years back. Now, the studies very clearly shows that about 2.2 million people go for work, they never return. And about 125 million people are affected by the occupational accidents, injuries, sickness, and all those things. Means to say that it's high time we should focus on these sort of issues.
It so happens that when you're off to work or at work, your mind is not in the right direction, and that's when these accidents happen, or is it some other reason?
Accidents do happen in industries, but if you categorize the accidents, we find that about 67% of the accidents happen because of unsafe acts, and about 33% because of unsafe conditions. And there can be other reasons like perception change, anatomical changes, physiological, psychological problems. All these issues can be linked to that.
Okay. Can you share with us what are occupational diseases?
Occupational diseases are diseases which arise because of one's occupation. Any individual can have the normal illnesses like diabetes, hypertension, heart diseases, all those things are routine illnesses which we all can get. But there are a set of illnesses which can happen because of one's occupation. Like for example, let's take an employee who is exposed to high noise. He is continuously exposed to high noise. So naturally what can happen is the risk because of that noise hazard is noise-induced hearing loss. Means hearing loss which happens because of the continuous exposure to noise. So that is something which we call it as occupational disease.
Okay.
So any disease which arises because of one's occupation.
Okay.
So noise is one among that.
Okay. Would you agree with me that there are more hazards with related to the IT industry that work late night shifts compared to the industry hazards before?
That's very right. I mean, it's a very relevant question. Like IT industry, it's an upcoming industry, and when we talk about hazards and industry, I mean, we talk about the industrial hazards. IT, of course, has to be considered as a separate category, and it is definitely an industry where we find people are working for 15 hours, 16 hours more than that. Now, in an industrial sector, we find people working for 8 hours, while in IT industry, there is no time restrictions. Like they work continuously. So naturally, they are deprived of their sleep. They are deprived of all their functions, day-to-day functions. The problems are much more in IT industry now. I think it's we got to do further studies on that. People have definitely started doing some studies on that. We find that IT industry, the major problems are when you get sleep disturbed, your output also definitely will be reduced. Some people say that they work for 5 days a week and 2 days you can sleep. See, 2 days you can't sleep continuously to compensate for the 5 days loss. Another is their vision. They will be focusing on the monitor continuously for 10-15. Then eye strain is a very common problem. Watering of eyes, congestion of the eyes. These are some of the visual disturbances are very common now, especially people working in IT industry. Their posture is again another problem.
Sitting posture.
Sitting posture. We call it as ergonomics. Ergonomics is basically the study of the posture of the individual. Like any job, when you do it, your posture has to be tuned to that particular job. So your upright position is something very important in when you are sitting in front of a computer.
And plus, there's more mental pressure in the IT industry.
Yes. And stress, again, is another major problem. Occupational stress, you can call it.
Okay.
When the requirements doesn't match your capabilities or the resources, naturally the occupational stress increases.
What are the different kinds of occupational hazards?
Well, the different hazards, I mean the hazards altogether, the industrial hazards can be classified as physical, chemical, biological and occupational accidents, occupational dermatosis and psychosocial factors. These are the different hazards involved in anyone's occupation.
Can you give us an in-depth on the hazards related to noise?
Noise, of course, is an unwanted sound. In factories, the rule says that in 8 hours, any employee should be exposed to a maximum noise of 90 decibels. Means an employee who is working in an industry continuously for 8 hours, he should not be exposed to more than 90 decibels on an average. Say sometimes he may be exposed to 100 decibels or 120, but on an average for 8 hours it should be less than 90. That is a permissible limit. Okay. Now, if by any chance, if an employee is exposed to high noise continuously for 8 hours, he can develop noise-induced hearing loss. And this noise-induced hearing loss is a irreversible problem. You cannot correct it also. There is no treatment for that. That is why in most of the industries, we focus on noise. What we do in most of the industrial sector is, first we focus on the engineering controls. Like if there is a defective machinery, you got to correct it. And if the machinery is creating more noise for the individual, then we have to have a barrier in between, separating the machinery from the individual if possible. And last only comes hearing protectors. First you have to think of all the other feasibility and then come to the personal protective equipment, where we give earplugs, earmuffs and all those things. Of course, all these things can reduce the intensity of the noise only, but you cannot get rid of all these problems.
What exactly is occupational hygiene?
Occupational hygiene is hygiene in related to one's occupation. It's basically recognition, evaluation and control of the potential hazards in the workplace. When you work in a factory, you are exposed to a lot of factors which we have discussed, the physical, chemical, biological factors. Now, you have to evaluate that noise, for which there are two ways of doing it. One is to find out the exposure of the individual. You take we call it as an instrument by name noise dosimeter, where you can attach it to your body. You can go around, for the 8 hours he will go around and we get an average of the noise he is exposed to. The second instrument is called sound level meter, which we can take to any work spots and measure the noise at that particular level. So with this we can find out whether it's crossing the limit or not. So like that you can evaluate any other factors, like for example dust is a major problem in industries. Now with a dust sampler you can measure the amount of dust this individual can be exposed to. Similarly light, there are people who are doing some precision jobs where the intensity of light should be more. Similarly gas expulsions in some factories, there can be leakage of gases and
petrochemicals.
Petrochemicals and all. There we have to measure the exposure of the gases by that individual.